So the RATIONALE-301 study, the primary results were presented at ESMO 2022, and this was a large Phase III study looking at Tislelizumab versus Sorafenib. This was an open-label study looking at Tislelizumab, which is a PD-1 antibody. It's a little unique in that it was designed as an IgG4 antibody, which does not bind the Fc gamma receptor on macrophages, which in preclinical models, antibodies that bind to that receptor, that attenuates the anti-PD-1 response. Now, this study was a non-inferior design. In the primary endpoint, it met that non-inferior design with a hazard ratio of 0.85 versus Sorafenib, and the confidence interval crossed 1, but it was within the non-inferiority boundary. There were key secondary endpoints, objective response and safety, which all favored Tislelizumab. And at this meeting, we presented the patient-reported outcomes. Patient-reported outcomes are increasingly important in Phase III studies to show that while we might improve the primary efficacy endpoints, that these drugs are also maintaining or improving quality of life. And as compared to Sorafenib, what we presented using several validated metrics and patient-reported outcome tools, that consistently Tislelizumab performed better than Sorafenib at maintaining quality of life readouts, and especially when you have a non-inferiority design where you can't necessarily claim a drug is better. At least for survival, we do show that Tislelizumab is better tolerated, and that's based on the safety and, at this meeting, the quality of life readouts.